Rosalind's mad because I stole all of her pillows to prop up my phone. Anyway, so we are almost done with this unit. I don't know if I'll finish it tonight, but we'll see. Many of us may be sensitive to some of the foods in our diet and not even realize it. It is obvious when we are outright allergic to something: throat swelling, numbing sensations in the mouth, etc. But it is more difficult to discover what foods may trigger more subtle inflammatory reactions in the gut. When someone eats something that they are sensitive to, they might not notice the effects for a couple of hours to a couple of days afterwards. Because of this, food sensitivities are notoriously difficult to diagnose. The most common food sensitivities are milk, eggs, peanuts, soy, wheat, corn, and tree nuts. Common symptoms of food sensitivities include acne and other skin rashes, joint pain, anxiety, depression, mood swings, diarrhea, sinus congestion, and indigestion of all sorts. Sometimes, food sensitivities are diagnosed using a blood test at a doctor's office. Sometimes, an elimination diet is used to determine food sensitivities. In an elimination diet, common allergic foods are taken out of the diet for a month or so and then slowly introduced one at a time. The potentially allergenic food is eaten for a couple of days while taking careful notice of any symptoms induced by the reintroduction of the food. In leaky gut syndrome, which is sometimes a result of or a cause of food sensitivities, the cells making up the lining of the gut wall actually begin to pull apart a little bit, no longer forming a tight juncture. With this extra space, particles that normally move through the lumen of the gut move past it and into the blood before they are broken down completely, creating an inflammatory response by the gut's immune system. Increased permeability leads to hypersensitivity responses to foods and even to components of the normal gut flora, potentially leading to autoimmune disorders. In addition to food sensitivities, leaky gut may be triggered by exposure to other substances that damage the integrity of the intestinal mucosa, such as viruses, bacteria, parasites, or even alcohol. Leaky gut may also be triggered by high amounts of processed foods, chronic stress, or zinc deficiency. Symptoms of leaky gut include nutritional deficiencies, chronic diarrhea or constipation, skin rashes. This is the body's way of trying to dump the toxins through the skin because the liver can't keep up. A low-functioning immune system, meaning the immune system is too busy with the gut to take care of any flu virus, headaches, brain fog, memory loss, and fatigue. The increase in intestinal permeability in leaky gut may contribute to other disorders as well, such as inflammatory bowel disease, gut infections, arthritis, psoriasis, dermatitis, eczema, irritable bowel disease, and chronic fatigue syndrome. The relationship between food sensitivities and leaky gut syndrome is complex. Following exposure to allergenic foods, the permeability of the gut wall increases. With an increase in gut permeability, more molecules move through the gut wall than should, increasing one's sensitivity to foods. Just as in other disorders of the digestive tract that involve inflammation, anti-inflammatory and tissue tonic herbs should be employed in leaky gut syndrome and with food sensitivities after the allergic foods have been removed from the diet. Because the liver of folks with leaky gut syndrome works overtime to remove macromolecules from the blood, liver tonic herbs such as dandelion and artichoke should also be indicated. Turmeric, a tropical plant in the ginger family. Turmeric is bitter, resinous, and pungent. Turmeric root appears yellow because of the chemical constituents within it, called curcuminoids. Collectively, these curcuminoids, such a weird word, are sometimes called curcumin. Turmeric is often sold in capsule form with a standardized amount of curcumin because to get a sufficient dose of curcuminoids, one would need to take a significant amount of turmeric powder each day. Turmeric has been studied extensively for inflammatory bowel disease. One review of human studies reported that taking a curcumin supplement allowed patients to take a significantly less amount of the pharmaceutical drugs prescribed to them for inflammatory bowel disease. A clinical trial has also reported that ulcerative colitis patients taking curcumin supplements stayed in remission longer than those not taking the supplements. Turmeric is also useful for stomach ulcers, difficulty digesting fat, inflammation of the liver, and stagnation of the blood. Because of its anti-inflammatory nature, it has been popular for arthritis, autoimmune conditions, asthma, and allergies. Because turmeric can be a little drying and warming to the gut, it is best used along with a demulcent herb like marshmallow. Turmeric should not be used long term or used medically by those with congestive heart failure. Those prone to kidney stones, gallstones, bile duct obstruction, or certain GI disorders should not use large medicinal amounts of turmeric. It should not be used medicinally by pregnant women. Stop using turmeric 2 weeks before surgery. Plantain leaf. Plantain is easy to find in the wild. Harvest the young leaves any time during the season while the plant is not in flower or seed. Plantain is cooling and moist, but at the same time can have an astringent quality. This makes plantain a fantastic vulnerary because it not only tonifies the skin and gut lining through its astringent properties, but also moistens and soothes. Plantain can be used as a poultice for bites and stings, and also to draw things out from beneath the upper layer of skin. It is also anti-inflammatory and mildly antibacterial, contributing to its usefulness for inflammatory bowel disorders, staph infections, boils, allergic rashes, eczema, hives, acne, and burns. Fresh plantain tincture is a great addition to a formula for anyone with an inflammatory bowel disorder. Wormwood. Wormwood's anti-inflammatory nature makes it a useful remedy for inflammatory bowel conditions. It has been studied for its ability to accelerate healing and improve mood in patients with Crohn's disease in a controlled clinical trial. Warm, bitter, and aromatic, wormwood is a small dose plant due to its thujone content and should not be given during pregnancy or lactation. Wormwood is easy to grow and it is the main ingredient in absinthe. Because of its bitter cholagogue, choleretic, liver protective, and anti-inflammatory nature. Wormwood can also be used for anorexia, indigestion, diarrhea, difficulty digesting fats, spleen deficiency, and jaundice. It is also a vermifuge and can be helpful in supporting the body to get rid of parasites. Fenugreek seed. Fenugreek is a moist and warm herb in the legume family that is easy to grow. Fenugreek has a maple syrup-like smell and is a common ingredient in Indian curries and in fake maple syrup. As a remedy, it is useful for any type of gastric or intestinal irritation and has been studied as a remedy for inflammatory bowel disease. Fenugreek is hypolipidemic, hypoglycemic, anti-inflammatory, carminative, demulcent, and expectorant. Fenugreek is contraindicated during pregnancy, but is safe during breastfeeding. In fact, it's a galactagogue. Yarrow. Yarrow's genus name comes from the Greek warrior Achilles, who brought yarrow into battle to help heal the wounds of his soldiers. Yarrow not only offers energetic protection, but also protects us from bacteria, fungus, blood loss, and inflammation. One of the best remedies for wounds, yarrow promotes the growth of new healthy tissue while protecting against infection and preventing blood loss. Often used as an external remedy, yarrow can also have this profoundly healing effect on the internal tissues of the body, including the gut, making it an important remedy for inflammatory bowel disorders. Yarrow is contraindicated during pregnancy due to its high volatile oil content. Gotu kola. Gotu kola is a salty, mineral-rich, water-loving tropical plant. A fantastic vulnerary and anti-inflammatory, it is useful for any internal or external wound and is particularly good at preventing scar formation. Gotu kola was traditionally used to prevent and heal ulcers. This, along with its ability to prevent scar formation, makes it a fantastic choice for ulcerative colitis. In 2010, the effects were studied on an isolated chemical from Gotu kola on rats with ulcerative colitis, and it was found to be a beneficial treatment. Gotu kola can be grown as a houseplant, and the fresh leaves are a yummy salad addition. Gotu kola makes a nice addition to tea and can also be tinctured fresh. Calendula flowers. Calendula is an easy herb to start from seed in the garden and can be quite prolific, producing flower after flower all summer long. Flowers can be continually harvested as they come into bloom and dried for tea or made into tincture or infused oil. Calendula promotes the growth and healing of epithelial tissue. It is anti-inflammatory and antimicrobial, reducing the possibility of infection from a cyst or wound, and is used internally and externally for wounds, inflammatory skin conditions, boils, burns, and bruises. Calendula has been shown as an effective remedy for ulcerative colitis in dogs and can be useful in any inflammatory disorder of the human digestive system. Gastroesophageal reflux disease, or GERD, is the occurrence of chyme refluxing from the stomach to the esophagus. Remember the esophageal sphincters? The lower one normally allows a little bit of chyme from the stomach into the esophagus about 1 to 2 hours after eating, but in GERD, the protective mechanisms that keep too much chyme from entering the esophagus are overwhelmed. Sometimes this causes heartburn. Other symptoms of GERD include hoarseness, laryngitis, nausea, cough, asthma, an increase in saliva, bad breath, and earaches. The symptoms of GERD can occur even if there is a small amount of acid in the stomach. In fact, people with low stomach acid, the stomach may take longer to empty, increasing the chances of regurgitation of chyme. Because symptoms of GERD are typically worse Thank you. I'm not paying enough attention to you. Because symptoms of GERD are typically worse when lying down, those with symptoms of GERD should not lie down for 2 hours after eating, so not eating too close to bedtime is helpful. Part of what keeps food or chyme moving down the digestive tract is gravity. If the sphincter opens while one is lying down, the chance of food coming up into the esophagus is greater. Alcohol and acidic foods like citrus and tomatoes worsen the symptoms. Certain foods and medication can also decrease the pressure of the lower esophageal sphincter, thus increasing the chances of reflux. These include coffee, alcohol, calcium channel blockers, nitrates, beta blockers, tobacco, and progesterone. Licorice root. Common flavoring agent for candies, licorice is a sweet, cooling, and demulcent root in the legume family. Hardy to 15 to 30 degrees below 0 Fahrenheit, licorice is easy to grow in the right climate, and roots can be harvested after 3 to 4 years. Licorice's anti-inflammatory and demulcent properties make it a great fit for GERD. In addition, licorice is an adaptogen, antiviral, aperient, and expectorant. Think of licorice when anything is dry and burning, like the esophagus in GERD and the throat in bronchitis. Some reports indicate that after long-term use, licorice can cause water retention. Thus, licorice is contraindicated in edema, pregnancy, and high blood pressure. Meadowsweet. Meadowsweet, yes, you're sweet. Meadowsweet blooms from around June through August with beautiful, fragrant white flowers. These flowers, along with the leaves of meadowsweet, are used for a cooling and drying anti-inflammatory remedy, especially useful for inflammation in the gut and on the skin. Meadowsweet is also used as an analgesic, alterative, antibacterial, astringent, and diaphoretic. These specifications make it a good match for GERD, heartburn, and gastric ulcers. In a recently published article in the journal Phytotherapy Research, it was demonstrated meadowsweet It was demonstrated that meadowsweet has a significant anti-inflammatory effect. Simply put, dysbiosis is messed up gut ecology. Proper gut ecology is necessary for good digestive function. The colony in the gut impacts how our body metabolizes, which affects the bioavailability and the chemistry of food and herbs. In fact, some herbal constituents are dependent on the gut flora to change them into their active form. For example, salicylic acid is ingested when we take meadowsweet or willow, and the gut flora needs to change this into salicin, which is the medically active form of the molecule. In a healthy GI tract, there are hundreds of different organisms. The colonization begins at birth and continues at high speed until around 2 years of age. Most of these critters are anaerobic. They don't require oxygen to survive, including E. coli. Gut flora have a host of jobs apart from their impact on our metabolism. Gut beasties feed the cells of the intestines, make vitamin B and K, help to maintain the mucus coating of the intestinal lining, compete with pathogens, keeping them from attacking the mucosal cells in the gut and acting as security guards in preventing infection, aid in normal transit time, and break bile salts into volatile fatty acids that inhibit pathogenic bacteria. Symptoms of dysbiosis include belching, bloating, fatigue after eating, rectal itching, post-adolescent acne or rosacea, anemia, chronic intestinal infections, chronic vaginitis, and flatulence, diarrhea, and/or constipation. If dysbiosis continues untreated, it can eventually result in inflammatory bowel disorders, autoimmune conditions, compromised immune response, and gallstones. Dysbiosis can occur due to stress, antibiotic use, inflammation, depressed immunity, parasitic infections, or poor diet, meaning lack of fiber, excessive sugar, high coffee and alcohol consumption, low in cultured foods. Eat food colonized with the goodies. Yogurt and sauerkraut, baby. Eat tons. If you can't eat enough, consider buying probiotics at the health food store. Just make sure you buy them from the refrigerated section so you can be sure they're still alive. Make sure the formula has multiple organisms as well as FOS. This stands for I'm not going to try to say that. For acute dysbiosis, mucilaginous herbs are helpful to support the mucus blanket of the GI tract, decrease inflammation, and to provide soluble fiber to feed the gut flora. Mucilaginous herbs such as marshmallow, licorice, plantain, and slippery elm should be taken in between meals. In chronic dysbiosis, it is most important to increase fiber in the diet, which feeds the flora. Decreasing sugar in the diet is also important. Helpful herbs include bitters, antimicrobials, and anti-inflammatories. In acute or chronic dysbiosis, it is important to supplement with pre- and probiotics. Probiotics, a combination of different species of helpful gut flora, can be found at most natural food stores. Be sure to look for brands that are kept in the refrigerator. You want as many of the microorganisms to be alive as possible. These beneficial microorganisms in our gut feed on prebiotics, substances found in plants such as dandelion, burdock, chicory, and marshmallow. These plants contain a prebiotic called insulin, which is basically a bunch of sugar molecules linked together that gut flora love to munch on. Stop! That's driving me nuts. Lick your foot over on your chair. Your breath. These plants contain a prebiotic called insulin, which is basically a bunch of sugar molecules linked together that gut flora love to munch on. One prebiotic herb is outlined below. Burdock root. Burdock is a biennial herb that can be grown in the garden or harvested from the wild. The root should be harvested in the fall of the plant's first year or the spring of the second year. These are times when most of the plant's energy is in its roots. Roots dug in the fall, however, will have the highest insulin content. Also slightly bitter, burdock not only feeds the gut flora but tonifies the digestive system itself. Burdock root is also hypoglycemic, mildly lymphatic, and anti-inflammatory with a special affinity for the skin. Burdock root can also be eaten as a vegetable. The end. Good night.